class. Here I want to talk about the flow of cerebrospinal fluid. And I'm just going to remind you real quick of the meninges here, and then I'm going to go to the model and use the model that you should be able to recognize the structures and the order in which CSF will pass as they're moving from the ventricles and ultimately into the subarachnoid space. So back to the meninges, that's where I want to begin. The outermost meningeal layer, that connective tissue element on the outside of the brain and spinal cord, is called the dura mater. So there's a space underneath the dura mater. Do you remember the name of that space? The space is called the subdural space. And then we have the next meninge, which is what? What do we call this one? It has little spiderwebby looking extensions coming off of it. Stringies. This is the arachnoid mater. And then underneath that we have our last meningeal layer, which is the pia mater. And that pia mater is right on the surface of the brain and spinal cord. So it's right on the surface of the central nervous system. So the spiderwebby extensions from the dura mater connect it to that pia mater. It's the subarachnoid space that's so important in the flow of cerebrospinal fluid. So it's this space here. This space is called the subarachnoid space. And that is where cerebrospinal fluid circulates and rotates outside of the brain and spinal cord. The arachnoid mater does have structures that, little out pockets like this, that cerebrospinal fluid, when it is circulating through, ultimately will be reabsorbed through that structure and back into the venous blood supply. So what is the name of that structure? That is an arachnoid, abbreviate, villus. Do you remember the name of the blood vessel that has the venous blood supply that CSF is going to rejoin? That is called the superior sagittal sinus. So let me show those to you on the model. In this model, here you see the superior sagittal sinus here. This is representing that large vein. So it is a venous blood supply. It's a vein that lies right on top of the longitudinal fissure. So like if I were to show you over here, the superior sagittal sinus would lie right on top of this longitudinal fissure. That is where ultimately CSF will be reabsorbed into to then rejoin the venous blood supply heading back to the heart. So let's use this model and let's do the rotation. We're going to start in the lateral ventricle. Remember the ventricles of the brain. We have the lateral ventricle, we have the third ventricle, and then we have the fourth ventricle. Way down here, it's actually in front of the cerebellum. So if we look in here, we have you name these. Name this ventricle, lateral ventricle. Name this ventricle, third ventricle. And as we continue down, this ventricle is the fourth ventricle. So the choroid plexus, which are blood capillaries in each ventricle, will produce CSF by filtering the blood plasma. CSF will enter the lateral ventricle and move through the interventricular foramen there to enter the third ventricle. CSF will then move down this structure. Name this structure. This is the cerebral aqueduct, which will then take CSF into the fourth ventricle. It will then leave, CSF will then leave the fourth ventricle through one of the two lateral apertures or through the median aperture to enter the subarachnoid space below the cerebellum. The CSF will continue to travel up and around the cerebellum within that subarachnoid space, and then continue around the brain, and then ultimately reabsorbed through an arachnoid villus into the venous blood supply. So if I come back to this one, that's one option for that rotation once it leaves the fourth ventricle. Some of that, however, will continue from the fourth ventricle and will continue to travel down the central canal of the spinal cord. Some of that CSF, after it leaves that fourth ventricle, will travel down the posterior side of the spinal cord and up the anterior side and within the subarachnoid space, and then up and around the cerebrum until it's reabsorbed through an arachnoid villus.